Hello everyone, good evening everybody. I am Sanya from beautiful Spotless Skin team. I am sure all of you must be keeping good health. Skin and hair health is the internal part of one's personality. Thus, taking good care of skin and hair health has become a prime focus nowadays for every individual. And to do so, many a times we explore options like over-the-counter brands or home remedies. But in the quest of doing so, sometimes we damage our skin and hair. For example, nowadays there are many cases happening of topical steroid abuse and fungal resistance. To make a right decision, it is very important to know who is the right doctor specialist, whom to seek help, what to use, and what not to use. To enlighten more on this for today's discussion on when to visit dermatologists, dermatocosmetologists, and dermatovenerologists, we have with us Dr. Smriti Choudhary. Dr. Smriti Choudhary, consultant dermatologist from Bokaro Steel City. Dr. Smriti has done her master's from NRS Medical College, Kolkata. She has been working in the field of dermatology from past 6+ years. She is attached with Welwork Hospital and KM Memorial Hospital as visiting consultant at Bokaro Steel City. Dr. Smriti is a life member at IADVL and ACSI. Her areas of primary interest are clinical dermatology, pediatric dermatology, psychocutaneuous dermatology, trichology, and aesthetics. Today, Dr. Smriti Choudhary will share her views and educate us on when to visit dermatologists, dermatocosmetologists, and dermatovenerologists. So over to you, doctor, and welcome.
Thank you. Thank you for the warm introduction and thank you everyone for taking out time. So let's directly jump on to our topic. So topic is when it's warranted to see a skin specialist.
Right.
Yeah. So most common query, why this topic? Why not directly some specific skin disorder, eczema, acne, hair, like everybody but does.
Right.
So, thing is, first I would like to share my journey, my journey to being a skin specialist, and
Sure.
then, where I would like to share this that till I became a skin specialist, I had not visited a dermatologist my entire childhood until I was in med school.
Okay.
And this is not only with me, this is with many people, many people.
Right.
Hesitation or lack of awareness or I don't know what. So what had happened, I had some sort of herpes zoster, and it was really painful. It was really I could not perform my daily activities, and it was diagnosed as insect dermatitis. And then I had so much painful 5 to 6 days, and then the spots. Same thing happened with a very close friend of mine. She ended up with acne scars. She had all sorts of acne, teenage acne, and then some nearby parlor auntie, she just popped out, squeezed everything, ending up in lifelong old scars, which we take years to combat. So this topic is specifically to emphasize on the importance on it's very important. It's very important. You're well aware about pediatrician, gynecs, general physician, surgeon, ophthalmologist also. But the moment it comes to go and visit a skin specialist, then we think it might be going away by itself, or let's go take some cream from over the counter. So at least after my talk today, you will be more aware of importance of skin diseases and importance of seeing a dermatologist. Yeah. So firstly, who is a dermatologist? We have seen many quarks, many other degrees. So the degree which we should go for before seeing a dermatologist is MBBS plus MD, which is Masters in Dermatology, Venereology, and Leprosy. I'll explain these three things. Or DVD, Diploma in Dermatology, Venereology. Okay. So what does a dermatologist see? Whatever is visible on seeing a person, right from top to toe. everything is covered by a dermatologist. Apart from your the eyeballs, even the lashes, even the eyelids, even the lower eyelids, even the lips, external ear also. When it comes to internal ear, then we can go to an ENT specialist. Yeah. So right from count, skin, hair, nail, the oral cavity, genital lesions, the sexually transmitted disorders. I'll come to them one by one. We are the specialist for leprosy, all sorts of cosmetological things. Okay, so most important, even if you're not having any such skin problem as it, but I would suggest everybody should at least visit once a dermatologist in their lifetime to know their skin type, to know if they have sensitive skin, to get an advice whether they should apply something, a cream in the cream form, the ointment form, or lotion form, or if at all it's important for them or not, how to take care of their hair, nail, just a single advice, and that will go for lifetime. Also, one confusion I have seen in people regarding children, the neonates. So dermatologist sees the skin, hair of neonate to old age. Pediatric dermatology, the children and all, and the geriatric dermatology, old age skin related problems. Okay. So skin is such an important organ. It's actually a mirror. It's a mirror, and you should whatever, any changes, anything, any new thing you see, it might be a meager issue, but then it can be a finding of as a bigger disorder as cancer. So you should never neglect and never just go and see a GP. He might not be aware, he might not catch the disease in such an early stage. So it's very important. I can give you certain examples. See, in West Bengal, the eastern part, it was found that people used to have certain dark raindrop like pigmentations all over their body, all black spots all over the body, and there was thickening of palms and soles. Suddenly everybody in the neighborhood started having that. And later, when government intervened, when there was a lot of investigation, it was found that arsenic was there in the water. So whatever we eat, whatever we drink, it's very difficult to know, and later this arsenic lesions, they cause squamous cell carcinoma. So this is the importance. Apart from that, we have acanthosis nigricans, the thickening of skin. You must have, it's very common, the thickening of skin in the back of the neck, in the underarm region. So this is an alarming thing. This is something which can lead to metabolic problem later in as manifesting as diabetes. In case of females, PCOD. So these are the signs. These are the early signs. So when these are caught upon earlier, we can really prevent the greater issues which can proceed later. Yeah. Other, we can see there's a blebs like appearance in children. There is reddish bumps like appearance in not even children, the neonates. So this is something which is manifestation of torch infection. This is a series of infection which is inherited from mother. So this has to be diagnosed, other it can be, otherwise it could have been life threatening. Yeah. Apart from that, I have already talked about even leukemia and all. There are bleeding spots, there are small spots, so they should be investigated. Another great example which is very common is Schamberg's disease. You won't get by the term, but then you must have seen many people have that dark pigmentation over their legs, especially the ones who are involved in jobs which involve a long-term standing. So what happens, initially there is just pigmentation, slight eczematous problem, but later there are ulcers, and those ulcers, they don't heal like that. They keep on coming for years and years. So if it would have been diagnosed in the early stage, we could have prevented that ulcer. Yeah. Okay. So I would go with organ to organ, so that we can specifically alarm you and create some awareness regarding the common problems for which you should visit a dermatologist. Yeah. So skin, see, we can have a generalized rash or a localized rash. It can be as small as an insect bite. It might go away. But you know what? Even insect bite can cause huge lymphatic problems. There are cases like that. The rashes, viral infections, which are accompanied with fever. So they need treatment. They need treatment. They can be infectious, those viral rashes. So the children they need to be isolated so that it doesn't turn out to be an epidemic. So socially also, this is an important thing. Also, small sort of itching and all, people itch at night, that might be scabies. It spreads from one person to another, especially in the family. And I've seen cases, they just get go on taking some antihistamines, cetirizine, levocetirizine, and they don't get cured, and the whole body, it's full of lesions. So it's scabies, and six-membered family, 7, 10, even all of them, just suffering from they are suffering from this scabies. So never neglect even a small itch. That might take a toll on your family. If you're having some illness for last you can't sleep for last 3 months out of itching, that's a great issue. Yeah. Okay. Also, one important thing is rash. See, okay, even the viral rash, if you can neglect it, well and good, it will go away in 7 days. But then it might be because of some drug reaction. And even if the first episode of the drug reaction is not that serious, you just need to get hold of the medicine, the inciting agent, the causative drug. Otherwise, if it is I mean, you go on taking the medication, that same inciting drug again and again, you'll get larger reaction, and it can even lead to life threatening issues. So this is the importance of a small rash. What you think is a mosquito bite is not a mosquito bite. It can be anything. Yeah. Also, in case of our country, this drug reaction has to be taken seriously, because here we have a lot of over-the-counter purchases of medicine. There is no such restriction. So we should never, especially if we are taking any medication like any antibiotic or any painkiller, we should really, urgently visit a dermatologist if we get any sort of rash. Coming to rashes, we have heard so much about COVID rash, and the newest one, the monkeypox rash. So monkeypox, till now, it's at least people are having history of foreign visit or contact with someone with foreign visit. But then if you are having some throat issues and skin, the rashes can range from vesicles, which you get in chicken pox, to as small as papules, ulcers. So you have to immediately meet a dermatologist so that we further go into the investigations. In case of COVID, we still have not seen any life-threatening skin problems. Apart from few vasculitic problems, rashes are there. So yeah, but then the skin problems are seen very commonly in case of COVID infections. Even after treatment has been done, it's seen. Now, I would, my aim is not to create a horror about skin disorders, but then at least I would discuss with you all some alarming conditions which you should be aware of. So, firstly, the autoimmune diseases, which people don't know. They visit physicians, orthopedicians, because usually autoimmune disorders like systemic lupus erythematosus, dermatomyositis, they come with joint issues, long-term fever, weakness, malaise. But then there is underlying skin rash, which people tend to ignore because it's not very prominent, but slight burning, slight irritation. So this ultimately, if SLE and all these things are not treated properly, ultimately it leads to kidney issues, lung, cardiological problems. So these autoimmune disorders, they have to be treated promptly. So whenever you find any absurd skin rashes over the face, malar area, or over your knuckles, over the chest, especially when it burns while going out in sun, never miss going out to a dermatologist. Secondly, infection. So what we have seen that children, they very commonly get pyodermas, pus-filled lesions. I'm not talking about everybody, but then if they are not treated properly, first the bacteria, it keeps on causing those pyodermas. This is mostly seen in the lower to middle socioeconomic strata children. So what happens later, that streptococcus, it resides in the body, and later that might attack our kidneys, causing glomerulonephritis. So this is the importance of even a proper just 5 to 7 days treatment can help us preventing such big organ involvement in future. So that is the importance even for a small infection. Yeah. Another thing is your allergies. Allergies are so important. One thing I would really like to share with you people is that allergy test, never go for allergy test by yourself. It's of no use. You should at least visit a doctor first, a dermatologist first. Let him or her decide whatever you need. Sometimes it's needless. It's really needless to just spend that sort of money and then expect that after knowing those things I would be treated. No, you can't. There are many other aspects of allergies. So never go for those tests by yourself. One more common thing which I am seeing nowadays is fungal infection, and they are treated like eczema with repeated steroid applications. Steroid itself is a menace. It causes so much of skin and other systemic side effects, and it's being used like anything. In fact, fungal infection, it deteriorates with steroid. And because everybody is aware of a disease called eczema, so you go to a quack or even a GP, he'll give you, and he'll go on. That is a vicious cycle. Patients have been applying steroid for even 10 years and it's not getting treated. So that clinical eye to diagnose between these things, that is with dermatologist only. So never rely for even smaller fungal infections to somebody else. Later what happens, no, if you keep on applying steroid for so long, there will be skin thinning, there'll be reddening, there'll be excess hair, stria. So never do that. Okay. Even that same goes with eczema. So while traveling and all, I hear people saying, I'm having eczema, mera to eczema ye to kabhi theek nahi hoga. No, it's not like that. Here comes the gap, the knowledge gap. Why won't it be treated? There is no such disease. I mean, eczema is not a great disorder, but then you don't get enough of knowledge about that. You keep on washing your legs with hot water, with neem water, which irritates, which makes it more dry. So even our daily lifestyle changes, daily things, those will be helpful for preventing, for treating the eczema. So there is nothing as this thing. I really want to give one take-home message that eczema is curable. It might come back, but then it's curable. Yeah. Okay. So this entire list of skin disorders, it's incomplete without the mention of vitiligo, which is something which has got a lot of social myth, many things, because people themselves start, secluding the one who is having this thing of vitiligo. Then they start some Ayurvedic, they start applying something, they stop taking non-veg diet, they stop taking salads and all, lemon and guava, then do all sorts of puja and all, everything. But what I want to stress upon is that it's an autoimmune disorder. It generates from inside. It's not something that somebody gets through their sins, or it's genetic or nothing like that. And the problem arises when after 10 years, 12 years of ignorance, wrong treatment, the progressive disease, the disease, it goes on progressing, and then it spreads like anything. And then when you visit a dermatologist, not much options are left with us. So why not visiting a dermat in the initial stage when it is spreading? We have to stop that medication right at stop the disorder right at that stage. So that is important. This is something which is the pigments, they come also very slowly and they go also very slowly. So if you come after this 40% and 50% of pigment loss of almost involving your skin, it's really difficult for us to again make you wait for next few years to get treated. So why not visit at the initial stage, right? Also, sometimes it's associated with thyroid problems. That is never, that goes undetected. So it's needed that you visit a specialist for that. uh, Apart from skin, let's come to hair problems. I have seen, I mean, every three or four persons out of 10, they complain of dandruff. They are having dandruff, and they keep on applying oil also. So this is a basic thing, that if you are having dandruff, the oil is gonna aggravate it. There is a fungus which feeds upon the lipids, the oils, and the more you oil, the more supply of oil will be there, the more growth will be there. So this is basic counseling education which we give. After that, they would really feel relieved. Secondly, it might be psoriasis, scalp psoriasis. So every dandruff which you feel as a dandruff is not a dandruff. It might be a psoriasis or a sebopsoriasis, which can later spread to your other parts of the body. So why not get it treated at the earlier stage, right? uh, One more, this is a rare thing, but then I would like to share. So a few people, their hair texture is like woolly. It's brown and coarse, and it doesn't grow that much. So we call it woolly hair. So you would be surprised to know that woolly hair is associated with heart disorder. So this is something which we can't ignore. The syndromes, Naxos syndrome, Carvajal syndrome. Here, just seeing the hair, we go for echocardiography, and it's caught hold of at early stage before some damage is caused permanently. So that is the importance of seeing even as small as hair issue. Yeah. Uh, Even alopecia areata, the loss of hair at patchy loss of hair from the scalp. There are some cases where there is alopecia universalis, all the body hair, brows hair, lashes hair, everything is lost. So if that stage is reached, it's really difficult to treat for us. So why not visit the doctor at the first, when you get one or two patches itself, it will be easier to treat also. Uh, but one myth I would like to break: hair fall. This is something which is overrated thing. We get a lot of patients with hair fall, but I would like to suggest that some amount of hair, it has to fall so that the new ones come. So this is something which I feel to some extent is people over stress this issue. Definitely, if there is excess hair fall, we'll go for the cause and all those things. It's very normal to get a hair fall post pregnancy or post some illnesses. So wait for some time. If people, anybody, they when they comb hair or when they shampoo, if they find some hair, they panic like anything. No need to panic, because see, our skin, our hair, or our nail, everything is growing. It's growing, it's detaching, and the new ones are coming. So if you are having hair loss, see whether it's more than 80 to 100 hair per day. Is it more than that? If it's more than that, if it's for more than 3 months, 4 months, then definitely you should visit a dermat. Yeah. Okay. Yeah. Do you want to are there any questions?
Yes, yes. There are some questions from our viewers also, ma'am. Priya Sharma is here, and she's asking how often should you go to a dermatologist?
See, there is nothing about a frequency. But as I mentioned earlier, at least visit once to know about your skin. To just make sure whether you are applying anything or any gharilu nuska, all those turmerics and all, whether it suits your skin. The aloe vera can cause acne. So first visit at least for awareness, for some knowledge. And see, there are few chronic disorders. There are many such things. So in that case, so you'll have to visit every month or every 2 months like that. But at least visit once to know about your skin. Yeah. Okay.
Yes. Ma'am, more questions are coming from our viewers who are watching us. So Suman Yadav is asking, I am diabetic. Do my supplements and or medication affecting my skin?
Okay. So she's diabetic.
Yeah. And do my supplements or medication affecting like?
Okay. Does the supplement
Yeah.
or medication affect their skin?
Skin.
Supplements might affect the skin. I'm not sure about the ingredients of which supplement she is taking. Medication, as per it, really doesn't affect. But there have been some studies that if somebody takes insulin patches or insulin injections, that affects the skin, and that also locally. But medications as such, they don't affect the skin. Yeah. Diabetes itself causes many skin changes, skin problems. Direct diabetes, the disease only, not the medications. Yeah.
Okay. So Kavita is here and she's asking, when should we start taking our children to dermatologists for regular checking?
Yeah. Okay. This is a nice question. This is a great question. See, initially, not only children, first one after birth. After birth. Because atopic dermatitis is something which affects a few children who are atopic very badly. They frequently get reactions to bites, the patches, the papules, so much of itching, so much of scars. They are disturbed like anything. So initially, before 1 year of age, then in case of any problem, or at that time, the dermatologist, he or she will be advising the daily skincare routine. The second has to be in the adolescence phase, because at that time the skin undergoes changes. Either it will get too much of oily, or it will get too much of dry, or hair loss or anything. And that is the time when children, they undergo a lot of psychological issues. So talking to a dermat, talking about their skin problems, that will be helpful not only for the skin but for their psychological this thing also. Because few boys, they start getting temporal recession. That is something very natural, because there is a reshaping of face once we get into adulthood. But then they feel very, they start applying minoxidil by themselves. They want hair this side. So this, we have to educate them, no, it's normal. And that we will find out whether it's going towards alopecia or whether it's normal thing. So once during after birth, once in the childhood phase, when the child starts playing, and third at the adolescence time.
Okay, so there's another interesting question from Tripti, and she's asking, my grandmother is 60 years old. What should we do for her skincare routine?
Yeah, nice question. So first thing is that the old age is a very difficult time for skin, because all the glands which keep our skins moist, oily, that shrink away. So the skin dries up like anything. There is wrinkling. There is itching. Apart from that, if she is suffering from any comorbidity, that will add up to the itching and dryness of the skin. So to combat that, a glycerin based soap is important, and daily use of soap is not advocated, just once or twice a week. And after every wash, not only after bath, even after every hand wash, or if she is into washing her legs, she has to apply a moisturizer. That is very important for her. Not rubbing the skin after bath, just dabbing the skin, not using hot water. It will add to the dryness. Yeah. Okay.
Okay. Ruti Nigam is there and asking, what is the role of a dermatologist?
So Shruti, I have been discussing, and I have many more things to share. I just have shared about skin and hair. There are many things. Please do stay. I'll really answer you throughout my session. Yeah.
Yes, Shri Sharma is here and she's asking, could my diet be affecting my skin?
100%, 100%. So skin is a reflection of many things: our stress level, our water intake, our sleep, our diet. Food is something which really reflects over our skin and hair. Yes.
Yeah. So Sudhanshu is here and he's asking, Doctor, how can I monitor moles and markings at home?
Okay. See, in Indian scenario, getting melanomas from moles is a bit rare because we are dark-skinned people. It is more to be worried about in foreign countries. But one issue is there: if somebody gets a lots of moles, they are very much, worried about that. But sometimes it can be because of sun exposure, or it might be genetic. So that is something which let a dermatologist decide. But then if you find a mole changing its shape, the borders are irregular, the color is getting brown and black, or if there is some bleeding, that is alarming thing. Meet a dermatologist at once. Yeah.
Yeah. Ma'am, so Palak Dubey is here and she's asking, how can I treat sunburn?
Sunburn. So firstly, I'm not sure about her diagnosis, because sunburn is something which is there in fair skinned, the Caucasian group of people. There, what we get is suntan. So in our race we get tanned. Burn is there, but then very less, very fair people. So regarding the treatment, most important is moisturizer. If it's already burnt, we have to see the extent of burn, how much burn, the depth of burn, the degree of burn. So better to meet a dermatologist. Till then, keep on applying moisturizer and sunscreens, preferably physical sunscreen. And apart from sunscreen, just don't rely upon them and go out in the sun. You have to use some physical thing like an umbrella or a stall apart from your physical sunscreen application. Yeah.
Yeah. Okay, so there are more questions coming up from our viewers. Advik Singh is here and he's asking, how do I know if I'm ready for Botox?
Okay. See, there is nothing as if you are ready for Botox. Usually, Botox, as we know, it's for wrinkles, the loosened skin. So, and the amount of wrinkling and loosening of skin, it depends upon many factors. It's not only, it's confirmed that at this age you need to start Botox. Whenever if there is more of sun exposure, there is more of stressful lifestyle, smoking is there, the wrinkling and all comes at very early stage. It can even come as early as late 30s. And the people who are taking care of their skin, they are good, they exercise a lot, they drink a lot, drink water a lot. So they can need Botox as late as late 50s. So that can't be universalized. We need to suspect that. Yeah.
Right. Thank you, ma'am. So Pooja Pandit is here and she's asking, what is the best technique to keep my skin moisturized?
Best technique. So best technique and most important thing is stop applying face wash again and again. Face washes lead to dryness of skin. Just once application. Know which face wash is suited for your skin. That a dermat will be deciding. But then don't keep on washing your face. Don't scrub your face. If at all you want to moisturize it, just wash with water and pat dry and then apply moisturizer. Yeah.
So they have to go and diagnose and go to the dermatologist for anything.
Because there are many ingredients in the face wash. No, if you give a salicylic to a dry skin, it will irritate more. So these things these technicalities has to be taken care of. Yeah.
Yes. So Neha Chaudhary is here and she's asking, how do I know that is my skin aging well?
Okay. So this is something very subjective actually, because I gave a hint of this answer actually. Your lifestyle. If you're not following a healthy lifestyle, your food, your smoking habit, your sleeping habit, so aging will be very earlier. The type of stress people are going through nowadays, so they are aging very early, even in the 30s. So if you get wrinkling, if there is a lot of blemishes, freckles, the skin will lose the glow. They won't be that thing. You will feel dullness, you will feel patchiness. So these are the things which tell you that your skin is not healthy. Yeah.
So when we talk about aging, is a question from Arpita. She's asking, how can I avoid wrinkles?
Okay, avoiding is a difficult word. You can't avoid wrinkles because aging is something that can't be, I mean, halted. But definitely there are few things. Firstly, that face wash thing. Don't apply face wash of too much, and a few things which you have to take care of in your skin routine is application of moisturizer and sunscreen. The more you moisturize your skin, the less wrinkling, the less I mean loosening of skin you will feel. Also, I would advocate against too much of rigorous massaging of face, too much of scrub application. Don't do that. That will loosen up your skin. I mean, people go for a lot of, I mean, these parlor people, they are not aware of the facial anatomy. They are not aware where to press, where to this thing. So that might lead to, that might backfire. So there'll be more loosening. Few days you'll feel tightening of skin. So if you go on just simple moisturizing and sunscreen application, that will take your skin a long way. Also, water intake is something which is very important. If you keep yourself hydrated, your skin will show that thing. Yeah.
Thank you, ma'am. So there is a question asking, my sister is going through radiation. What should she be applying to soothe her skin?
She's going through.
Radiation.
Okay. So see, you can apply moisturizer first thing, and after that, calamine based lotions. That those are important. Those help in soothing. But then, that this is something which will just alleviate the symptoms, not treat. So for getting treated, we need to see how much has the skin been affected with the radiations. Yeah.
Okay, so Suman Yadav is asking, what's the best way to handle sensitive skin?
Okay. So, firstly, I'm sure that he knows that he's having sensitive skin, because it is difficult to know that by oneself. Yeah. So the best way to handle is apply less amount of soap, just once or twice a week. Don't rub your skin too much, and again apply lotions, moisturizers. Also ceramide based will be preferred, so that has to be applied, and the frequency of application, that has to be increased in winter season, because at that time the skin gets dried more. In case of rainy season, some extra protections are needed. Yeah. So, and don't just go over the counter and buy retinol based products and all those things. That will irritate the sensitive skin like anything. Yeah. Oh,
Yes, sure, ma'am. So Ishita Jha is here and she's asking, how can I fix an uneven skin tone?
okay. So before fixing it, we have to know what is the real problem. Why has she got the uneven skin tone? Whether she is having melasma, or whether any other freckles or anything, or uh, tanning is there. So firstly, the diagnosis has to be corrected. For you it is uneven skin tone, but then the cause is not something which will be revealed, which you can get by yourself. That has to be investigated upon, and there are further medications for different problems. Yeah.
Okay. So there's one more question from Suman Yadav asking, how can you treat acne and anxiety induced flare-ups with skincare?
So the answer is in the question itself. See, if it's known that it's anxiety induced, definitely you need some stress busters, and definitely some sort of meditation and all will help. And if it's not pathological, okay, you can manage it by normal meditation thing. But then if it is, I mean, affecting you too much, you need to see a psychiatrist. Apart from that, the acne which is happening, that we will see which grade of acne. There are total 4 grades of acne. So whether some other inciting agent is there or not, so that we will be able to find out. Yeah.
Yeah. So Sonia Iyer is here and she's asking, hello, doctor, melanoma isn't a huge concern for people of color.
No, it's not. It's not. Melanoma is the third common skin cancer of people of color. and it's very rare. The type which is seen in people of our color is acral lentiginous. So we should, I mean, basal cell carcinoma of skin is more common, much more common than melanoma. Just because West people, they show it too much in the media and all, they need to worry about that, not us.
Okay, ma'am. So Suresh is here and asking, my father have developed white flaky skin between his toe fingers. What should he do?
Probably he's having a fungal infection there. Regarding treatment, definitely we have to go through all the comorbidities, everything, then only we can decide his treatment. But one thing I would like to emphasize in his case is he has to keep the toes spaced. Just keep on wiping the extra moisture there. Don't leave that area wet for long. One thing I advise to my patient is that take an ice cream stick, wrap it with gauze piece or some sort of cotton, and place it between the toes so that there is proper ventilation. So keeping it dry is important, and definitely you have to start medication. Yeah.
Okay, so Rupali is here and she's asking, which sunscreen should I use if I have psoriasis? It's spelled like Psorasis.
Achha, she's having psoriasis. Actually, psoriasis has nothing to do with sunscreen and all. Sunscreen decision will be taken on the basis of your skin type. In fact, some sort of UV radiations are used for treatment of psoriasis. So never think that psoriasis get exacerbated or aggravated with sun exposure. No, it's not like that. So decision of sunscreen application is completely separate from psoriasis issue. Yeah.
So Abhishek Manji is here, ma'am, and he's asking, should we use moisture in oily skin also?
Definitely. So moisturizer is something which we should follow for every type of skin. But then that is something which we have to decide that which moisturizer in which form it has to be given. Usually for oily skin, we prefer lotion form. Yeah, which is not that much sticky. Yeah.
Okay. So Nilesh is here, ma'am, and asking, ma'am, how will I know which thing I am allergic to?
See, this is a very, I mean, exhaustive list, because allergies can range from food item, then we can have it from sweat, our own sweat, then we can get it from sun exposure, too much of exercise, too much of stress, all those external things, the artificial food, artificial dye, artificial those coloring agents which are mixed with our, I mean, cake and jam and sauce. Then the common one is dust, detergent is there. So there is a long and exhaustive list. So you have to definitely try to just correlate about the exposure, and then if you are getting any lesions, that what I had taken, where had I gone, what I had eaten, what I had worn, whether it's because of some synthetic clothes, that you have to introspect.
Okay. Priya Sharma is here and asking, do I need different products for morning and evening?
Not exactly. Actually, for not evening, for night, actually, little formulation is different, and that also is dependent upon the age, because we prefer retinol based creams at bedtime for a bit of people in their 40s. So not exactly, even if you apply same thing in the morning and at night, that is fair enough. Apart from sunscreens, they are not needed at night.
Okay, ma'am, and this is a quite informative session for all our viewers. And any takeaway message for all our viewers?
I still have few things to share. I'll just go away in speed. So I was discussing about nails. Nail is something which we ignore, but then it is very important for our confidence. So nail issues, they might be a reflection of internal issues like psoriasis, lichen planus. So you should see a dermatologist for a nail problem. Apart from nail, if you are getting recurrent oral ulcer, don't think that it is only because of vitamin B deficiency. It might be lichen planus, or it might be leukoplakia, which can turn into cancer. So for any issue of oral problem, for any issue of a tongue, anything you are seeing, you are getting burning sensation on eating, so meet a dermatologist for oral issue. Coming to genital problem, I really want to emphasize this, that females, especially female, they tend to ignore the genital lesions, which are very important. There is a disease called lichen sclerosus. What happens if you keep on ignoring it? It causes strictures in your anal and urethral opening. So that is something which requires surgery. So why not get diagnosed by a dermatologist at an earlier stage? Okay. So any sort of genital lesions you see, any discharge, any pain, any burning sensation, both male and female. So this is a myth that male can only go to a male dermat and female can only visit a female dermat. No, both of male and females, they can visit anybody of their choice. Nothing like that. Sexual issues. So there is a thin boundary where we have to decide whether we are going to treat those problems or we'll refer them to psychiatrist. Yeah. And the thing which is more of hype nowadays, cosmetic issue, cosmetology. I would like to share this with our viewers, that let the doctor decide which is best for you, which is best for our skin. Because this time in the Google era, people are like doing Instagram and Googling, and they are coming with suggestion that, madam, can you do CO2 laser in my face? No, don't go for that. Don't do that, because you are not aware of that thing. For you, that is the only mode of treatment of scar. But then for us, we have many more modalities which are more effective for scar treatment. So kindly keep away those Google researches for your skin treatment. When you are visiting a specialist, let him or her decide. Yeah. And one thing which people are not aware of, that a scar created by a surgery can be removed by a surgery. So a dermatologist is a dermatosurgeon as well. So if you are having any sort of ugly scar because of any prior surgery, because at that time a surgeon was operating it, his priority was surgery, not those cosmetic things. So we are there to help for those things. So if you are having an ugly scar, you want to get it removed, meet a dermatologist, you will get rid of that thing. Yeah. So we have limited time. I actually wanted to share a lot of things. There is so much thing to make people aware of regarding skin problems, because these are some things which are visible. If something, if complications are there, that is completely because of our ignorance. We could have visited our dermats at an early stage. Yeah. Okay, so are there any questions or we are done?
I think we are done. And any takeaway message for all our viewers, ma'am?
Definitely. So my takeaway message would be, first, never ignore any skin problem. Never ignore. A visit, it will hardly take 10 to 15 minutes, but then it might, at least in 2 to 3% only, but it might get you to be aware about something great, something, a big thing which might be popping up inside. Yeah. So visit a dermatologist. And secondly, never ignore genital issues. Meet a dermatologist, see a dermatologist. Okay.
Thank you. Thank you so much, ma'am. And thank you so much, Dr. Smriti Choudhary, for your valuable time. It has been very informative session for all our viewers, and it is great to hear you. We really look forward for many such sessions for our viewers in the coming time.
And giving me a platform. Looking forward to many more. Yeah.
Same here, ma'am. And thank you, viewers, for all your participation for today's session. Good day to you all.
Okay. Bye-bye.